Hi, my name is Dr. Rick Scala. You know, there's one thing I'm sure of today. That is, that if you're watching this program, you or someone you care about has low back pain, neck pain, or pain into an arm or leg. More than likely, you or your loved one have tried any number of treatments for this problem, and if they had worked, you would not be watching this program. Today, I'm excited to talk to you about a revolutionary new, non-surgical, non-invasive procedure for back and neck pain. It has a 70% success rate. I'm talking about MUA FRP. But before we get to the specifics, let's help you understand a little bit about low back pain and neck pain. Studies of low back pain reveal that 80% of Americans will suffer from debilitating low back pain at least once in their adult life. Most of you will have multiple episodes. Low back pain is generally caused by several things. For many of you, your first injury starts out with lifting or some other form of exertion. This causes muscle, ligament, nerve, and tendon injury. If you're like most folks, you self-treat the problem. Rest, ibuprofen-type drugs, analgesics, and over-the-counter things like Motrin. In some cases, the symptoms eventually go away. But when the symptoms do not go away, you go to see your chiropractor or your medical physician. If you go to a chiropractor, your treatment generally consists of spinal manipulative therapy, physical therapy, and perhaps some exercise. If you go to a medical physician, your treatment is probably going to start with prescriptions of things like muscle relaxants, pain medication, perhaps some physical therapy, and in some cases may lead to surgery. So let's take a look at the statistics of success of what you may have tried so far. Rest alone is helpful in a small minority of multiple back pain cases. Drugs are no better. Obviously, your back pain is not caused by a deficiency of soma or some other drug in your system. So putting in those drugs only provides temporary relief. Medications may help you better participate in therapy, but statistics prove that not one drug cures low back pain. And we have all seen what has happened with drugs such as Vioxx and Celebrex lately. While most studies agree that chiropractic treatment is the most effective and long-lasting for some people, there are certain disadvantages. Chiropractic treatment can take a long time to work, and for about 30% of back pain sufferers, it never fully relieves the pain. Surgery on backs has become more and more used in the United States, but the success rate for many procedures is still less than 50%, and in some cases as low as 25%. I don't know about you, but I think those odds stink. Physical therapy helps some back and neck pain sufferers, but the percentage of success is still nothing to brag about. I have heard too many therapists start out telling a patient that they have to learn to live with the pain to make me, as a physician, feel comfortable that physical therapy is going to work for you. Well, this is a pretty dismal story. You're probably asking yourself, what in the world does work if all of these modern medicine approaches do not work? So let's talk about the good news. What can you do right now to potentially eliminate your neck, back, or limb pain? Not just temporary relief, but lasting relief. Would your life be better if you had less pain or no pain right now? Can you picture what you would be doing right now if you were not in pain? Our group of healthcare providers are specialists in a procedure called MUA FRP, which means manipulation under anesthesia with fibrosis release procedure. You see, many chronic subacute cases of neck, back, and limb pain are the result of scar tissue in muscles, tendons, ligaments, inside joints, as well as nerves, which are not corrected by drugs, rest, exercise, spinal manipulation, physical therapy, acupuncture, surgery, or waiting until it goes away. Before we speak with one of the nation's leading providers of this treatment, let's meet some people just like you whose lives have changed following this treatment.
I injured my neck and lower back, and I've had numerous therapies to date until I've had the MUA here.
I was tight. I had a burning sensation in my shoulder.
Well, the things that I couldn't do before I had the MUA, I wasn't able to bend very much forward or backward. I wasn't able to turn my neck left to right very far, as well as up or down with my neck. I was not able to work before I had this procedure.
I feel much better. I don't feel all the burning sensation I had in my shoulder that I had prior.
I feel tremendously better since I've had the MUA procedure done here.
I know I'll be fine after the procedure. I was fine yesterday.
I'd say it's an overwhelming success.
It got rid of my pain, so therefore I would recommend it to anybody that's in pain.
I would recommend the MUA to everyone that I meet that has the problem that I've had.
Well, you can't argue with results like that. Wouldn't you like to be able to tell others how great you feel and how improved your life has become? Let's talk now with Dr. Ed Cremata. We're going to a local outpatient facility where Dr. Cremata, along with several other physicians, provide manipulation under anesthesia procedures to help people just like you get out of pain. Dr. Cremata, how are you doing today?
I'm doing quite well, thank you.
Dr. Cremata, tell us, how long have you been in practice?
23 years.
How long have you been doing MUA and how many have you done?
I've been doing MUA for approximately 5 years. As far as my own patients, where I've been the primary, I've probably done about 200 or 300 cases, and I've been involved in about 1,000 cases as a proctor and an assistant and such.
Well then, it's reasonable to say you have a lot of experience.
I have quite a bit. There's others that have more, but yes, I've done quite a few of them.
Dr. Cremata, we've just heard from some patients who've told us some pretty amazing stories of results they've gotten as a result of MUA procedures. Is this typical of what happens for most people?
You know, we can never make any guarantees to any particular individual about how a procedure is going to turn out for them, but I can tell you that one of the things that we're so enthusiastic about is that the results are so great. And the results are actually quite good, with about 70% of patients in our studies being very satisfied after the procedures. So to answer your question, yes, the procedures are quite good. And keep in mind that this isn't a population that hasn't responded to many other treatments.
Dr. Cremata, I know you are busy with patients, but could we trouble you to let us briefly watch a part of an MUA procedure today? And then, do you mind staying with us?
You're certainly welcome to come in and observe the procedures, and I'll be happy to stay around and answer any other questions you might have.
We're about to go into a procedure room at this outpatient facility where MUA procedures are performed every month. The person you're about to see has been put to sleep with mild anesthesia that will keep them asleep for about 15 minutes. But before being put to sleep, they were examined by a medical anesthesiologist who determined the best anesthetic agent to use. We're only going to watch a few minutes of what takes 15 to 20 minutes to perform. The procedure team consists of 2 doctors of chiropractic, a medical anesthesiologist, and a registered nurse. Dr. Cremata will explain and comment on what we're seeing.
Well, Ms. Wilson is having an MUA procedure to the low back and thoracic spine, the mid-back area, and essentially she's got a lot of areas in her spine and she has a lot of tight muscles that aren't being released with normal in-office care. So she's had a long period of care from medical physicians and chiropractors, and she still ends up with these areas that just don't move properly. Because of the abnormal ranges of motion that she has, whenever she goes to use her spine, it gets very irritated, swells up, and causes her symptoms. So when she came in here, she had a lot of pain and a lot of disability and a lot of impairments. What Dr. Scala is doing right now is, with the help of Dr. Chen and the anesthesia that Dr. Chen gives her, Dr. Scala is actually able to release these areas that have been real tight and are keeping her from getting better. So there's a lot of reasons why we decide to do these procedures in patients. As Dr. Chen was saying, he referred this patient partly because she wasn't a good candidate for other procedures, and the chiropractor generally recommends this procedure when her problems are still mechanical in nature, and she has a lot of motion restrictions that are at the foundation causing her problems. So far you've seen us do a lot of stretching of the lower extremities and the hip joints, which get very tight. And what Dr. Scala is doing now is releasing the motion restrictions and the adhesions that are actually in the joints of the back themselves. So he'll take it to the end range of motion, Again, with Dr. Chen's help, it relaxes the musculature and he's able to get a lot more done than he was able to get done in an office setting. He has very tight quadriceps muscles. These muscles are right in here, so we have to stretch them, let up, and go a little further until we get her more toward normal. And we just do a little at a time each day until we reach normal motion. It's important that we bring the motion back in these articulations in all ranges of motion. So Dr. Scala released it on that side, and this will help to eliminate the joint restrictions from rotation to this side. And the application of these stretching and myofascial release and manipulation procedures that are done, the actual spinal adjusting, it applies to anywhere in the spine. So, for example, this patient is having low back and mid back, whereas the patient we did before her had problems primarily in the neck and the middle back. So the process is the same, is you select the patients that have substantial motion restrictions that didn't go away with the in-office treatment. So they could be in the neck, the middle back, the low back, the sacroiliac joints, and sometimes we get referrals for a knee that might be real frozen up, or a shoulder for frozen shoulder syndrome.
Wow, I can hardly raise my leg up, let alone bring it up that high. Now you can begin to understand why sedation is necessary for this procedure. After the procedure, the patient is taken to a recovery area where specially trained nurses monitor them until the effects of the anesthesia wear off. Well, let's go back to see Dr. Cremata now. Well, Dr. Cremata, what we saw in that MUA was truly amazing. Dr. Cremata, are the results really as remarkable as we've been hearing?
Actually, they are. We're very pleased to be able to provide these procedures because you get pretty dramatic results in most patients that are properly selected. So I would say that about 70% of patients that go through these procedures end up very satisfied with the procedures.
I understand this is a 3-day procedure. Could you explain that to us?
Yes, most patients with very chronic conditions do undergo a series of 3 days of manipulation under anesthesia. There are some patients that aren't as bad that may only require 1 day or 2 days, but I would say that most chronic patients do require 3. We try to loosen up a lot of the scar tissue and a lot of the fibrosis that's keeping people in pain and keeping them from responding to other appropriate treatments. But in most cases, you can't do it all at one time. You have to go sort of slowly and in progression in order to do the job safely.
Dr. Cremata, once a patient completes 3 days of MUA, what happens next?
Very important question. After the procedures are done, the important thing is to maintain the increased range of motion that these procedures will give you. So the patient has to agree ahead of time to go to their doctor for 8 weeks to repeat all of the procedures that were done to bring back normal ranges of motion and reduce scarring in their office for about 2 months. So what we request from the patient is that they return to the doctor for 2 months and follow with very specific procedures that will be sure that they maintain these ranges of motion, and to include an exercise program so that they're strengthened and coordinated within these new ranges of motion.
I see. So you're saying that the success of the procedure depends on the rehabilitation afterwards. So why not just do the rehab and skip the 3 days of MUA?
Well, most of these patients have had rehabilitation. The problem is that they haven't had the rehabilitation and the exercise program within the normalized ranges of motion. So what this manipulation under anesthesia will do is bring back normal ranges of motion so that the rehabilitation program will appropriately strengthen them and coordinate them with the new motion ranges.
If you or a family member suffered from low back or neck pain, with or without limb pain, would you recommend this procedure for yourself or a family member?
Absolutely. If you choose the patients wisely for this procedure and they do the follow-up properly, this is, in my opinion, the safest and most effective procedures for good candidates with chronic pain.
Dr. Cremata, thank you very much for your time today. I know you're busy, so we will let you get back with your patients.
My pleasure, and I hope that this information helps some people that relieve their pain.
Well, there you have it. A non-invasive, non-surgical approach to getting rid of your back, neck, and limb pain. If this has not convinced you that MUA may be the answer you're looking for to give yourself back a pain-reduced and/or pain-free life, then I have not done my job. I know you have questions. They need answering. And obviously, there are some preliminary steps you need to take before receiving this treatment. But can you picture yourself living a normal, pain-free life? That's the question we started with. Do you want to be pain-free? Do you want a non-invasive, non-surgical solution to your pain? Obviously, the answer is going to be yes. You want to be pain-free. So let me tell you what your next steps are. In a moment, the phone number of a doctor who specializes in MUA will appear on the screen. Call that doctor. Tell the office that you have seen this video and that you want to make a free, that's right, free consultation appointment with the doctor. They will schedule an appointment for you, tell you what information you need to bring with you for your free, that's right, free consultation. It's that simple. Isn't that a fair way to find out if you are a candidate for MUA? Put a stop to your pain, make the call today, and get the relief you need and want. I'm Dr. Rick Scala, and I thank you for your time and attention.
Call now for your free consultation appointment. Call 510-796-2225. That's 510-796-2225. Call now.